So this time we are going to see a slide of pancreas. First, I'm not going to tell you how I said this is pancreas. We'll deal about it later. Now I'm having a disorder of pancreas which is having multiple rounded structures like this, right? You can see the multiple rounded structures. We are going to see similar thing in a liver. The first thought for you is going to be a cirrhosis, a fibrotic nodule, right? So I will imagine that this pancreas having fibrotic nodule. I'm zooming it up. This pancreas having multiple fibrotic nodule, and these are nothing but the caught up pancreatic glands in between them. First thing. So then I have certain areas which are predominantly bluish in color. There are certain areas which have a predominant bluish color. Here as well, right? So I'm having certain areas which are predominantly blue, and a blue structure for me in microscopy is going to be nuclear structure. So I'm going to zoom into that. So what I'm going to see is I'm seeing predominantly tiny round blue cells, which are nothing but the lymphocytes, right? We have seen this how lymphocyte is going to look in histopath previously. They're nothing but lymphocytes. I'm going to zoom in further. What I'm seeing is I'm seeing few cells which have a blue nucleus which is towards the corner and which has a pink cytoplasm. This cluster, have a look at this cluster, and have a look at this cluster as well, right? I'm having cells which are eccentric nucleus with a pink cytoplasm. What are these cells? Excellent, they are the plasma cells. So I'm having a lesion in the pancreas with a dense aggregate of lymphocytes and plasma cells. That's the second finding for me. The third finding, what is this structure? There's an artery, right? You have a lumen, RBC, and the wall of the artery. What is this structure? This is a vein, right? So I have a vein. The wall of the vein has the same inflammatory cells. The wall of the vein has the same inflammation. So I call it a phlebitis. It's an inflammation of the vein, phlebitis. I see a finding of phlebitis. Not only that, look at this tiny little structure. This is also a vein. But what has happened to this vein compared to this vein is this vein has been compressed totally because of the surrounding inflammation. This vein has been compressed totally because of the surrounding inflammation. So I call this finding as obliterative phlebitis. The vein is being obliterated. In the center, what I'm seeing is the exudate and surrounded by an inflammation. That's phlebitis. Not only that, we'll see one more vein as well here. See here. This is also a vein. Normally, the lumen of the vein is going to be bigger than an artery. See here. It's being compressed. What is compressing it is the inflammation. When it takes more time, this vein will become like this, where it will be completely obliterated. Right? So we saw three findings today. The fibrosis, the lymphoplasmacytic infiltrate, and obliterative phlebitis. Right? So what I'm going to give a diagnosis here for this disorder is, I'm going to call this as suggestive of IgG4 related disorder. This is a new disorder, relatively new one, but has been catching up the attention of many medical people, right? So how do I diagnose IgG4 related disorders? First, I should have a dense lymphoplasmacytic infiltrate. Okay, I should have a dense lymphoplasmacytic infiltrate. That's necessary for me, which you saw. I should have a fibrosis. Yeah, that's also necessary. And it should usually in storiform character. We'll see what storiform is soon. And I have to have an obliterative phlebitis. All this helps me that it's suggestive of an IgG4 disorder. It's not diagnostic. What I'm going to do next is I'm going to apply IgG4 and IgG immunohistochemistry. I'm going to do an immunohistochemistry for IgG4 and IgG when the ratio is greater than 40%, which means the predominant plasma cells here in this biopsy is secreting IgG4. Then yeah, I'm sure the diagnosis is IgG4 related disorder. Everything is pathology. So I need a biochemical parameter as well. I can evaluate the levels of IgG4 in the serum as well. If it's going to be greater than 135 milligram per deciliter, yeah, that's also suggestive of an IgG4 disorder. Right, so we saw everything. We didn't know what is storiform. Actually, storiform means this one, the spokes of a wheel. That's called storiform. Right, so I'm going to go to the next picture, whatever we saw, the histopathology picture again. See, look at this. Low power, we saw the fibrous tissue, right? I'm gonna go zoom it up a little bit. See this entire rounded structure. Imagine this is a wheel outline, right? So spokes is gonna enter from the outline into it. When I'm going to zoom it up, the fibrous tissue is not only in the septa. See, look at here. These are also fibrous tissue, which means my fibrous tissue from the septa is also going into the nodule. Look at here, right? It's going into the nodule. So I call this pattern of fibrosis as a storiform fibrosis. This is not the case in case of a hepatic or a liver cirrhosis. It will be seen only in the border. You can see it anywhere. Anywhere if you see the fibrosis, it goes into the tissue. It goes into the tissue. The fibrous septa from the periphery is going to go into the tissue. This pattern of fibrosis, I call it as storiform fibrosis, right? It looks like a spokes of a wheel. It's just an imagination, right? So when I'm going to have this particular type of fibrosis with above set features, I'm going to say is an IgG4 related disorder. So why it is essential for me is there are predominantly many types of disorders which has been reclassified into IgG4. I'll list out a few. There is a whole long list. I'll list out a few of them. Autoimmune pancreatitis, it has been reclassified into an IgG4 disorder. Autoimmune thyroiditis, yeah, if it fits into the criteria, I can reclassify into IgG4 disorder. Miculus, yeah, IgG4. Riedels also been reclassified into IgG4. Idiopathic retroperitoneal fibrosis, what's the other name? The Ormond's disease. That also has been reclassified into an IgG4 mediated disorder. An inflammatory pseudotumor. There are many diseases which have been reclassified under this disorder. Why I'm reclassifying here is I have an etiology now. My search for any disease is going to how it's going to cause the disease. If I know how it is going to cause the disease, I can easily treat the disease. I know an etiology, so I can focus on that. I can use the treatment, right? So all of this disease, when I see the above mentioned picture, what I've reported for this histopath slide which you saw was autoimmune pancreatitis, probably IgG4 mediated. That will be my diagnosis. Then, yeah, when I have this diagnosis, you're going to have a clear-cut treatment protocol for that. That will be discussed by Dr. Rahul Rajiv in the video soon, right? So I can have a treatment diagnosis and I can have a treatment. From entrance point of view, what is going to bother you? Look for this point story form in your questions and the criteria for all except the values of IgG4 and the percentage for IgG4 versus IgG. And the disorders which has been reclassified that also can come as what are the following are IgG4 disorders all except, right? Fine. I'll see you back soon with one more set of videos. Till then, have a good day. Bye bye from Dr. Anjan.